Welcome to the Life Unscripted podcast with Rosabel, the place where genuine conversations meet inspiring stories, personal growth, and a dash of humor. I'm Rosabel, your host, inviting you to embrace life's unpredictable journey, celebrate your unique story, and find joy in everyday moments. Get comfortable, stay curious, and let's explore together. Unscripted, unapologetic, and unstoppable. Hello, everybody. Welcome back to another episode of the Life Unscripted podcast with Rosabel. Today, we have a very special guest with us, Melissa Winger. She's the author of a book called Who Cares? The Real Patient Experience. In this powerful book, Melissa shares her personal story of navigating the healthcare system as a teen mom and with a son who has complex medical needs and intellectual disabilities. Over the course of 2 decades, she experienced firsthand the emotional and logistical hurdles of advocating for her son's care within a system that, as she puts it, is pretty much broken. So in this episode, we're going to dive into the challenges of healthcare advocacy, the emotional toll it takes on families, and how we can strive to be treated as equal human beings in a system that often feels indifferent to our most vulnerable moments. Melissa, thank you so much for being here today.
Thank you for having me. I'm honored to be on your show.
Absolutely. Thank you. It's a pleasure to have you here. So, Melissa, let's talk a little bit about let's start with the personal journey and perhaps the birth of your book. The book, Who Cares? The Real Patient Experience. It definitely shines a light onto the healthcare system from such a personal perspective. But before we dive in, can you tell us a little bit about your journey? What led you to write this book?
Yeah, so I had my son in 1996, so quite a long time ago. He is now 29 years old, and I had him when I was at the age of 18. And me and his dad he was 19 at the time, and we did not have a lot of family support. It was pretty much him and I, and we did not have a diagnosis for my son, not prenatally, not even at birth. We had about 4 months of repeatedly going to the ER with my son because he could not eat. Every time he ate, he turned blue, losing weight, never would wake up, never would cry. But it took about 4 months for anyone to listen to us and actually give him a thorough exam. Not his pediatrician, not the ER staff on many occasions. And so finally we did get a diagnosis, and his diagnosis was what we were told not compatible with life. So we were told because he was missing half of his 4th chromosome and he had duplication of the 6th chromosome, and no other person has been born like that and never will be, because when you think of chromosomes, there's so many individual little bands that even if somebody was missing part of their 4th chromosome, it's likely not going to be the same number of bands. So, but what we were told was that likely probably affected how all of his organs were formed. And that ended up being true, but we even got one of our diagnoses just a few years ago that he was born with. So we've been dealing with new issues with different organ systems up until, he was probably 26 years old.
So you had such a challenging journey, Melissa. Can you tell us about specific moment or event that perhaps made you realize that the healthcare system was fundamentally broken for families like yours?
There was not one particular issue. It was a combination of many issues. And it wasn't even one healthcare setting. So it was the actual hospital care. Then we had issues with home care. Then we had issues with medication. So it just accumulated. And every time something would happen, it would be so frustrating that I always wondered, is this what people go through? Or is something I'm doing wrong? Is this really how the system works?
Right.
Yeah.
I figure that was because usually it's not one thing, it's just a combination of many, many, many things. And now you do mention in your book that as a patient or a family member, we often intersect with the medical system as our most vulnerable moments. How did you first realize that advocating for your son was actually going to become a necessary part of navigating this healthcare system?
That also is challenging. It still is to this day. You are told all the time that you need to advocate for yourself. You need to advocate for your son. And the problem is if you're a person that, like myself, runs from conflict, I just want to be happy. Everything works out. I don't want to be in conflict with anyone or anything. Then there's a side of the mother bear that comes out where you get extremely upset. And then it's almost like you crash. Like I advocate for him and I'm frustrated. I'm upset. I speak out. And then it's like I go back or go like into my car and I crash because it's almost like an introvert doing that. Like it's like it was too much and you kind of melt down. And then I just started thinking, okay, so I have to advocate in the school system. I have to advocate in the healthcare system. Why am I always having to defend my child's existence? Why am I always having to defend his needs to everybody when the system, I assumed, was there for the patient, that they have to take care of the patient, and the schools, they take care of the students? I was wrong. You have to fight for everything. And someone that's adverse to that's not an easy task. And we shouldn't have to.
Absolutely. And also in the book, you share, again, as you're just telling us, all the emotional challenges and perhaps dealing with, healthcare professionals, to not say anyone in particular. But can you tell us about a moment where you felt like, I know you went through a lot of difficult little moments, but if you can remember one moment where you felt like, okay, the system was truly, truly failing you and your son, something that perhaps will resonate with any of our listeners.
Yeah, it was where my son doesn't fit into the norm of maybe what a hospitalization or an admission should look like. And the fight for me to advocate for him and to say I know him best. And this perhaps was it was an emergency room stay. My son was about 13, and my son, very happy-go-lucky, but however, he is nonverbal, and he also has severe intellectual disabilities. So I got a call from the school. He was acting extremely abnormal, super upset, and just we couldn't calm him down. I brought him home and same thing happened at home. He was just frantic and something was very wrong. I took him to emergency room because my main concern was that he does have a history of brain aneurysms. So I thought this was a neurological change. But what happened in the emergency room is the assumption was that he was having a mental health issue because of his developmental disabilities, all of that. And so we were put into a mental health sort of safe room. He wasn't examined. They just thought it was a mental health thing, and they were waiting for psychiatrist or a counselor, which took hours and hours and hours. And finally I gave up, and after just repeatedly saying it's not behavioral, I know that you assume people with disabilities have behavior issues, which I do argue in the book that that's a bit unfair because they are allowed to get frustrated. They're allowed to get upset just like you and I are. It's not always a behavioral issue. So I brought him home, talked to his doctor, and said this was our experience, but there's still something wrong. There's something very wrong. We got scheduled for an MRI. Sure enough, that an aneurysm that was very tiny had gotten extremely bigger, much, much bigger, admitted to an ICU. And I'm just grateful that aneurysm didn't burst. I mean, it could have been instantly fatal.
Yes.
But it was a number of people just simply not listening to me. And that happens, I think, a lot to a lot of people.
It does. Because you just shared that, what advice would you give to someone who's in the middle of a crisis? Again, just like you, facing a healthcare system that feels indifferent or dismissive.
That one is kind of hard because it takes a lot. You can always ask for a patient advocate, patient representative. That has also been a big issue because if you are also labeled as a complainer, that also affects your care. I will be very honest about that. Even though they encourage you to advocate, when it's actually done, it's not always accepted or appreciated. You become sort of a problem patient. So, I mean, I think the really getting a system that you trust, getting a doctor that you trust, a doctor that you can even call while you're sitting in an emergency room to advocate
Yes,
for you.
absolutely. You also, just by hearing you talk, you definitely highlight the emotional toll of advocacy,
Mhm.
especially when you're already dealing with your own grief. I mean, your fears, your worry.
Mhm.
But still, my question is, how do you navigate those moments when it feels like this is you just said it, that is the last thing you can do is advocate. But how
Mhm.
do you push forward for yourself and for your child?
I have learned to, once I understood that this was our life going forward, unless the system changes, unless more people like myself speak up against how we're treated in the healthcare system, because what I think is happening is we've accepted it and we just accept it. Well, that's how it is. And I really want to say, no, that's not how it should be. But what I had started learning was this was going to be happening to us all the time. And I always stop and enjoy my son as much as I can and take time to just enjoy what we have. No stress, no conflict. When times are good, enjoy it. Enjoy that peace. Do things. Don't focus your entire life around a medical need because there's more. There's more.
Indeed. Also, in one of the emotional moments in the book, you do share a conversation, perhaps with a pediatrician, where you said, I can only imagine you. I can picture myself going like, I want you to care. I mean, what do you think it means for healthcare
Mhm.
professionals to truly care about their patient? And I mean, how
And I
can we
do,
create a
yeah.
system that, is the norm rather than the exception?
Mhm.
Because it's have become an exception.
I learned in this journey as well that I'm not the only one frustrated with the medical system. Our providers are just as frustrated. That pediatrician, just wonderful as he is under a ton of pressure. Does
Yes.
he want to take time to focus on helping me? Honestly believe yes, he does. But he's under pressure to see patients every 15 minutes. And that's where you're seeing this high level of burnout in that industry,
Absolutely.
is because that's not why they got into. I don't believe people got into this industry for quantity. Like, I have a goal, I'm going to see X number of patients in a day. I don't think that's the goal.
Right.
And the pressures to
Yes.
have to do that are extreme. Those are the things we have to change.
That's one of the reasons I personally left primary care, because the amount of time that I was allowed to see patients,
Mhm.
it's not quantity. I mean, it's more quantity, meaning like more patients, less time to develop.
Yeah.
Now I find myself, I'm actually, in the specialty, which I have a little bit of extra time to dedicate to my patients, which they do appreciate. And I do appreciate that well, because I'm
Mhm.
able to research, to have the time
Mhm.
to do what we're supposed
Yep.
to do the best job that we can do. And again, you've been through so much with your son's
Mhm.
healthcare journey. I know these questions are like, it can seem so general. What can we do? Or what do you think needs to change in the system to prevent families from having to fight for basic human decency in healthcare?
There is a pattern that I believe I have brought back to an original source of our reimbursement problem, especially with government programs. Not to get political, but I think because of such a low, and we're talking our sickest, most complex patients that may be on Medicaid or Medicare, and the reimbursement to care for those patients is extremely low. Therefore, providers need to see twice the number of patients just to keep the clinics up and running.
Absolutely. Yes.
Yeah. And we can't find home care because the reimbursement for our home care staff is so low that the nursing shortage has been the same as it was since my son was 1 year old to where he's 29 now. I do feel that that is a reimbursement issue. I feel like we're losing a lot of our emergency medical services, our ambulances, because they care for a lot of people on government programs and they can't keep up. They can't even operate anymore, and they're shutting down. I do feel like there's always, you can always go back to the poor reimbursement and the fact that now my son is 29. We're in the adult system. He's on our 10th primary care doctor. Either primary care clinics don't accept Medicaid,
Or
or
they leave.
they leave, or they can't take care of a complex patient in 15 minutes.
It is unsustainable.
Yep. And they don't say we're not going to see them. They say, I don't have the resources.
Yeah.
I'm not going to do a good job for you. And they are very transparent.
Have I not found the opportunity that I found to be in the specialty that I am now, I probably would have left the profession because I was burnt out. It was too much. I didn't have time for not just, again, you don't have time to properly care for the patients, but you also don't have the time to take care of your own families at times. And if we don't take care of ourselves, we're also humans too, you know? So it's complicated. It's definitely a complicated, and I am very thankful to be able to be part of this conversation with you.
Yeah.
I happen to be that, a provider myself.
Yeah.
And so, but after, again, everything you've been through, what did you hope your book accomplishes for readers, especially those who might be, again, facing similar challenges with this healthcare system?
What I'm hoping is it will be a call to action from anyone that reads it. It can be a patient, it can be a caregiver, it can be a provider, it can be someone that is in policymaking, to see the full journey and I go all the way from our prenatal care system all the way to long-term care, following one patient, one person, my son. And I go into how medical records don't even work anymore. That system, I think, has completely gone off the rails, if you ask me. And going through that and seeing not just one episode of care, not just one hospitalization, but what a patient goes through in their entire life, just in existence of one day, all the systems that we have to interact with, looking at the big picture.
Yes. Having EHRs or electronic health medical records that don't communicate with others, and it can be complicated.
Yeah.
And then what about particularly in the topic of advocating? What advice would you give these families when it comes to advocating for the care that they deserve?
I think there's actually an approach that is more of a partnership approach versus me against you.
Yes.
And avoid accusations at all costs, and I had to learn this. I had to learn what the provider was up against as well. And the sort of bureaucracies that go on within clinics or hospital systems. Didn't know anything about the insurance industry. I barely knew about how Medicaid reimburses. If you have that mutual understanding where you can partner and work together and not be adversarial and not be confrontational, because I think just human nature that makes everyone step back.
Yes.
And not that I want to say you have to try to force people to like you or like your child or to like your loved one. That's not it. It's this, I know that you have to see 25 patients today. I just want, to know if we can talk about XYZ. We can, just this mutual understanding.
Yes.
And not
Communication.
adversarial. Yeah.
Communication is key.
And where families get into it is their frustration just builds and builds and builds. And finally, they just let it out maybe to one provider where they're like, oh my gosh, and it's like, no, it's this constant partnering. And also prioritize your needs. I can go into a medical appointment. My son has 30 conditions. We're not going to talk about them all. And I'm prepared. And I've written down, these are the 3 things I want to talk about. Number 1, so I understand they have limited time, but I need to make sure I address this first.
Yes. And what would be one thing that you wish healthcare providers understood about the families that they serve, especially when it comes to children with complex medical needs and disabilities?
A simple thing that, because early on when I couldn't get a diagnosis, no one would listen to us. Finally, he's emergently admitted for his intestines were malrotated at 4 months old, emergency surgery. And afterwards, it was like, I knew something was wrong. Nobody listened to us. I was so angry. I was so upset. And there was a pediatrician rounding. I had never met this person. And he came in and he was like, I hear you. That must have been like acknowledge my feelings. And he was the first person to say, you're doing a good job. You are doing a great job. You are an excellent mother. Tears. That's the first time I cried because I had been under so much stress. That meant the world to me. That somebody, because I thought at that point that I was just this terrible mother, that I wasn't giving my son the proper care. And then it's all he said, you're doing a good job. Giving people that confidence. Oh my gosh, it was so simple. It was so simple, and it changed my outlook on the medical system.
Empowered you.
It did. I was the first person
Now,
to say that.
for someone who's listening today, because I mean, we don't know who's listening out there, right?
Yep.
Who perhaps feels hopeless,
Mm-hmm.
like they are alone in their struggle.
Mm-hmm.
What is a message that you will share with them to encourage them to keep fighting for the care of their loved ones?
It took a very long time for me to realize this, and it took somebody else to say this to me. And my son was, he probably almost was 20 years old at this time, that said, because my job was, I am his mother. My only job on this earth is to protect him, keep him safe from harm, and his survival. You can't put that much pressure on yourself every single day for 20 years. And someone just said, and I'm not necessarily a very religious person, but I am a Christian. And they said, he has his own purpose in this life, and you have purpose in this life. Maybe you were given this for a reason, and you're supposed to do something with it. And my son was given what he has for a reason. Maybe it's to inspire empathy and compassion in other people. And that alone is what made me think I have to take our lives and turn it into good. And that's why I started writing the book, started advocating, saying, my gosh, this is our purpose. It was given to me for a reason. I was given this challenge for a reason.
Yes.
We're going to do something with it.
In your book, when did your book publish?
2023, and it took about 4 years to write. It's divided into medical systems. So I talk about home care, patient safety, medical records. And then I just take my personal story and my son's story. And that's the beginning of every chapter of why this particular health system is important, because this is what can happen to patients. And then I go into the second half of the chapter, a ton of research on why the healthcare system maybe was designed this way, or how it just ended up because of failed designs is what I kind of consider it. And I do that with every chapter, because if you really don't care about the issue I'm talking about in that chapter, it kind of pulls you in to see, oh, I had no idea that medical records can actually affect a patient in sometimes horrible ways. Kind of pulls you in to care about the topic.
Melissa, what is next for you? I mean, are you writing another book? What are other, and your advocacy efforts? Tell me.
I just want to get the word out, especially the stuff that's in this book. I want change. I believe change for complex patients, lifelong patients, will then create more positive experience for patients that might just have one ER stay.
Perfect.
And to partner with your patients and caregivers. Let's change this. We're all frustrated, and it's so big that people are afraid to tackle it, I think.
Yes. Where can listeners find your book?
Yes, so I have a website, www.whocaresbooks, books with an S, whocaresbooks.com. And on my site, you can see links to all social media, and you can find out where to purchase the book. There's also some tips on how to work with your providers, and a way to contact me. Love opportunities to talk about this topic.
Awesome. And is there anything else or that you would like our listeners to know? Perhaps something that I have not touched on that I have not asked you?
No, again, this is just, it's so big that nobody really wants or needs to. They're like, someone else will take care of that. Like back in the beginning where I thought, well, if my son does need to be in long-term care or group home, and this is 1996, I thought, well, it's going to be better in 2025. And it's not. It takes a village. We all need to work together.
If you don't mind me asking, how's your son doing?
He's great. He's absolutely great. He is just a marvelous human being. He is so happy. And he's in liver failure now, but he gets up every day, puts a costume on, and sings and dances all day. He's
So
such a
he's
delight.
nonverbal, but he does walk and
He walks, particularly dances or skips.
wow,
Yes.
that is awesome.
He is a true joy. I mean, literally to anyone that comes in contact, he's a very memorable kid.
What is
I still call him a kid, even though he's 29.
yeah. Well, I was just gonna ask you, what is his favorite character?
So he's like, so developmentally, he's still kind of a toddler level. So he's Barney. We've been
Oh,
watching Barney for 30 years. He particularly loves the old school Barney, Sesame Street, and any musicals, Mary Poppins, Willy Wonka, all of them. Such a sweetheart.
wow. To be a child forever. Huh?
Yeah. That means I can have a forever baby too.
And like in life, like in anything else, I mean, things happen. Life happens to all of us in certain ways. And this is just something I always say. Just count our blessings. I believe I shared with you sometime the little story about my son. In fact, I'll tell you this real quick. A couple days ago, I encountered a family member of one of my patients who this person shared that she has a daughter who has a developmental disability, something like my son, interestingly. And the thing is, in my son's case, like agenesis to corpus callosum, meaning the corpus callosum of the brain did not develop right. It's the weirdest thing. The same thing it happened to this person's daughter, but and my son has the same thing. But of course, there is a difference, like you mentioned in the genetic makeup. They both share the fact that the chromosome 7 is a duplicate, but she has, I believe she said chromosome 10, it's like there's a deletion in it. My son only has that 7 and so on. Her daughter, unfortunately, has quite some developmental stuff. My son, he's doing okay. So it's hard sometimes because, makes you wonder, like, we're happy, we're thankful that my son has developed pretty well. He's doing great. I mean, you will see him and you will never know, if I'm telling you this, you will never know that he's missing that part of the brain. But it's hard sometimes when I talk to these other parents because same condition in a sense, different outcomes, you gotta count your blessings. Now, that little girl has some other things. Like, for example, I believe she walks with difficulty, but she can walk, or she's able to. So again, there's always something positive. That's what I'm trying to say. And it's just, life is just, we don't have the answers. I mean,
And
to so
enjoy.
many things.
You have to enjoy your loved one. I
Yes.
wish I could go back in time and tell that to my younger self. Because
Enjoy
I
our,
focused on his medical needs every day, that I didn't just enjoy being a mom and son.
but you still have him. He's still
I
here.
do.
And then every day there's a new opportunity to do those things. So, Melissa, your story is truly inspiring, and also your willingness to speak out about the flaws in the system. I think, with no doubt, it will help others who feel that they don't have a voice. Now, before we wrap up, again, you can find your book, Who Cares? The Real Patient Experience, by going to your website, right?
Yeah. And you can wait because I have an Audible book in production that's going to come out in May.
Yes.
So if you're an Audible person, that is coming.
That's what's happening with my book right now. I can't wait because people are reading here and there, but Audible is the thing now because people are going out there for a run, for a walk, or they're driving the car. And so,
yeah.
So
I'm excited about it too.
Yes. Yeah. Kudos to you for doing an audiobook. That's the thing. I'm the same. I'm waiting to. I'm waiting for my book to come an audiobook. And in fact, as soon as I can, because I'm trying to do this to all my guests, I'm sending them a free copy of my book so you can read it as well.
Thank you.
So,
thank you for all you do as well. And thank you for having this platform for us to have these conversations. I'm grateful. Thank you.
Thank you. I mean, it's been an amazing experience. And one of the things I was thinking, today you have given me the opportunity to have this conversation with you and to talk as a provider here in this space, because I don't do that very often. I focus more on other people's, stories. I don't do that very often, but it's a blessing in a way that I'm able to have, different stories here. So thank you. And for all of you out there, if you have been touched by Melissa's story or you have your own experiences to share, be sure to connect with her via social media. Yes, by going to the website, you can find you can probably go out there and click Facebook, Instagram, and so on. And I think engaging is very important, especially for those who are navigating similar challenges. And also, if you did enjoy this episode, don't forget to subscribe to the Life Unscripted podcast. Don't miss out any more conversations that matter. Leave a review if you can, and it helps us reach out more people who might need to hear these stories. And as always, feel free to reach out to us with any thoughts and feedback. Thank you so much for joining us today. Thank you, Melissa. It's been a powerful conversation. I know our listeners will truly appreciate hearing your insights. And for everyone else, thank you for tuning in. Have a great day.